Hello class, my name is Antonio Resto and today I'm going to be presenting my capstone project and it's going to be on nurse shortages and the effects on quality care, in this case in the emergency room. So my objectives for you all is to learn statistics about nursing shortages, to learn the risk that these shortages have in the emergency room, background and significance of the proposed topic, as well as what literature shows and what is the proposal to fix this current problem in the emergency rooms. So the rationale or purpose of this capstone project is I picked this particular project because I work in an emergency room as a new nurse. I've been a nurse since July at a very busy emergency department, and I have been a witness of the downfalls of working short staff or having an increased nurse to patient ratio. So according to an article by Aparicio, he states that nursing shortage is predicted to reach 12.9 million in 2035 if no action is taken, and this was as of 2020. So this is a very real problem, not only in the emergency room, but in nursing overall. According to another article by Gorman, emergency nursing recruitment and retention is a multi-phase issue that requires urgent attention to develop tools and strategies to support organizations to build a sustainable workforce. And this was as of 2018. I interviewed the new manager for the ED that I currently work for, and he shares some statistics of our own ER, and 45% of nurses are actually seasonal contract nurses. So it's not even core staff. The other 35 are nurses with less than a year of experience, which I'm one of those. And the other 20% are actual nurses that have been there since before the COVID-19 outbreak, so for about 2 years. According to him, the nurse retention turnover is 46% as of June 2022. So the background and significance of this particular problem is, well, recognizing life-threatening symptoms promptly and accurately is the fundamental purpose of an emergency department registered nurse, and we are vital to that critical role. According to a study by Banda, there is a link between nursing workloads and quality care in critical care areas where it has been shown that high nursing workloads negatively affect both patient care and nursing outcomes, and this was as of 2022. So obviously, the more patients a nurse have, the worse are the outcomes for those patients. Nurses who have more than 4 patients experience higher rates of burnout, working longer shifts, which a lot of times the shortages are replaced by, you having to work extra shifts, sometimes mandatory, sometimes it's optional. But yeah, you do have to pick up extra shifts to help the workload. So that working extra long shifts or extra shifts, the burnout is 2.5 times more common in nurses who work shifts of 10 to 13 hours as opposed to 8 to 9 hours, which we know the reality of nursing, at least in hospitals for sure, we work more than 12 hours a day. Also, stressful specialties, which ED falls into that category, they have the greatest rates of burnouts, followed by ICU nurses. So continuing on in the background and significance, in a stressful situation when you are either working, like for example, in my ER, there was a time we were working 5 to 1 when the actual norm will be 4 to 1. You have more patients, which means that you have to kind of work in a rush, cut corners, not follow exactly protocol to make sure that you're doing what you need to do for each of your patients, and that results in infections, more infections. For example, putting in a catheter or cleaning the dressing of a central line, things of the sort. If you're cutting corners and not following protocol because you are in a rush or overworked or tired, you're putting your patients at more risk for infection. Obviously, with that being said, you as an ER nurse, you have to be more focused on your most critical patients, and then those patients who are stable kind of linger in the back. And if you have more patients than you should, obviously the perception of that patient is going to be that they're not being cared for or attended to appropriately because your hands are tied with the more critical patients. So that is going to lower ratings for hospitals. And nursing experiencing burnout receive lower patient satisfaction ratings as a result. And like I mentioned earlier, the whole cutting corners, putting your patients at risk for infections, also increases a high mortality rate. 7% increased risk of patient mortality when nurses have more than 4 patients. So, the problem statement. The question is, in the emergency rooms, how does acuity-based staffing compared to standardized nurse-patient ratios affect patient outcomes in emergency rooms? So, literature review. What does literature tells us? So, staffing impacts the capacity in which all nurses can provide a quality of care that is safe, timely, and compassionate. According to the ANA, an increasing body of evidence shows appropriate nurse staffing contributes to improved patient outcomes and greater satisfaction for our patients and staff. And that was as of 2021. According to a study of 730,000 surgical patients, showed that patients were more likely to die within 30 days of admission when the nurse's workload was increased by 1 patient. That was a study by Borgold 2022. All literature used for this capstone project share the same concern. Nursing shortage and retention leads to poor patient outcomes. So, the proposal for my plan, this is a description. My proposal will be to include ways to reduce nursing shortages while improving nurse retention and working towards better patient outcomes. So increasing staff nurses, lowering patient ratios, proper compensation and bonuses, and preserving the current nurses. I propose a ratio of 3 patients to 1 nurse, new hires sign-on bonuses, offering yearly incentives for nurses for each year they remain employed, and marketable starting rates for experienced nurses as well as for new nurses, because I noticed transitioning into the nursing career, nurses should start getting paid way more than the current rate is, and I feel like that's a huge problem, making it a career that more people are going to want to jump into. You know, obviously you cannot do nursing for the money alone. You have to have a passion for it, but at the end of the day, this is a career that we all pick to have a better life and be able to provide for our families and what the case may be. So for the implementation part of this capstone project, I partner up with the manager at my local emergency room and discuss this capstone idea, and he was totally on board. This manager is a new manager to our facility. He has been working as a nurse for over 20 years, and he started actually as a paramedic. Then he was a nursing secretary at the ER. Then he got his LVN. Then he got his RN, became a charge nurse, and then he went to school to get his bachelor's in nursing, and currently he is our new manager. So he knows all the roles of the different people that actually work in the ER. So he is a great fit for the ER because he kind of knows what it is to walk in our shoes type thing. Evidence shows that establishing a healthy work atmosphere that encourages collaboration, that is fair, accommodating, and challenges the nurses by providing growth opportunities will entice nurses and keep them engaged and loyal to their place of work, therefore decreasing turnover. According to Nordiana, there is a significant relationship between retention strategy and organizational structure, leadership support, planning function, staffing function, and controlling functions, and need strong support from hospital management to achieve success in improving nurse retention. That was as of 2019. The goal is to present this proposal to the administrative staff of the hospital and medical board in the hopes to implement these interventions to create a policy change. The target population will be the ER nurses and the community they serve. Possible limitations include budget, access to hospital data, and support from the healthcare entity. The plan is Obviously, there's different interventions that are going to be proposed. The goal is to at least get one or two to be approved, and that's up to a great start. So what are we going to do to evaluate the performance of these proposed capstone? Well, in the nursing perspective, we are going to assess the effectiveness of this proposal. Um, we're going to start by using statistics or data from 6 months ago and compare it to 6 months moving forward. We're going to do so by collecting data, conducting surveys. This will be done by third-party companies. That way there is no biases. This will help us, see how the staff feels about the changes and if it's getting better or worse. Obviously, all of this will be done confidentially. Nobody is going to know who was the one who submitted the survey. It's going to remain anonymous. Also, it's very important to do monthly one-on-one roundings, like the managers, to talk with every nurse in the department to see if they have the tools and equipment that they need to do their job, if they feel like they're appreciated, what can be done better, if there's any current things that could be done differently that they think that could be done better. And they could use that information to make changes around the department to increase nurse satisfaction and retention. Also, right now we're having a lot of nurses that are moving on and leaving on the ER, and I think it's very important to perform exit interviews for these nurses just to see what is causing them to leave the facility. What are some things that could be done differently? Why exactly are they leaving the facility? And that will help managers and above use that information to make changes that are going to be beneficial for the incoming nurses or the nurses that are still remaining employed. In the patient perspective, then we obviously have the hospital HCAHPS. We should see those going up. We should see lower infection rates that we could use data from the infection control or quality control. And again, we could do that over the next 6 months to assess the improvement of those infection rates, mortality rates, and also see what the patients are saying about the nurses. I think like reducing the nurse to patient ratios, like right now we haven't done 5-to-1 in a while, but the 4-to-1 is still a little complicated, especially when we have very sick patients. I think decreasing it to a 3-to-1 is going to give those nurses more opportunities to check on their other patients, and so they don't feel neglected or forgotten. But yeah, that's how we will evaluate. So for the dissemination part of this capstone project, I focus on leadership. Research shows that leadership plays a huge role on nurse retention. According to Marufu, lack of support from managers and staff feeling not valued, followed by a negative management or leadership style, were the most common issues that had a negative effect on nursing turnover as of 2021. Therefore, it is important to see the perspective of a leader and their view on said difficulty. For this capstone proposal, I interviewed the manager of my local ER and did clinical hours to observe how staffing assignments are handled, how many full-time core nurses are hired, how many are contracted, patient ratios, patient satisfaction ratings in the ER, and observed that what was being done to address the nursing shortages in this facility. I was able to form a successful collaboration with this leader, and our hope is to bring this proposal up together to upper management. So for the summary, the nursing workforce continues to deal with shortages due to the high turnover, inadequate compensation, high patient ratios, and the need for more nurses due to acuity in patients. Healthcare entities must ensure meeting the expectation of nurses to ensure the continuous care that only a nurse can provide to their patients. It is also important to address staffing ratios and to consider the patient's acuity level of care when making assignments, as this will reduce burnout, compassion fatigue, and will considerably reduce negative patient outcomes and retain nurses and begin a positive pathway to decrease nursing shortages. And here are my references. Thank you for watching, and I hope you guys enjoy my capstone project proposal.